Hello, good morning. I think we are live and good to be here on a Friday, May 15th. This is Craig from the laboratory to Combat Human Trafficking. And thanks for joining us here today. We're having a little conversation called Stay at Hope, and we're really checking in on human trafficking and talking about this issue that we work on here at LCHT during COVID-19 and a little bit about what we're noticing in this time in the anti-trafficking work that we're committed to, and the reality that exploitation hasn't stopped for the coronavirus. And we're going to spend a little time talking about how we are prepared as an organization to continue working on this issue during the crisis. Obviously, also beyond this crisis, a little bit about our hotline, some news actually we have to share with my guests who'll be joining me in just a moment. And we don't know what the future holds in these moments, but we know that you can make a difference in the issues and the movements that matter to you, like anti-trafficking. So we'll talk a little bit about that. Obviously, out of the gate here, just want to say for those joining us, I hope you're well and healthy. And just a shout out to if you joined us before, the mural that has given us a lot of hope in the last few weeks from Austin Z Art at Austin Z Art down on Colfax Avenue in Denver. So I'm going to bring in my colleagues. We are all remote today as LCHT, and now joining me is Amanda Finger and Brittany Austin, and I think you guys are both up and with us. Hello and good morning. Amanda is obviously our co-founder and executive director at LCHT, and Brittany is our hotline and advocacy manager. So good morning, and how are you both doing?
Good morning.
Good morning. Thanks.
We'll see how this all works together. This is our first time doing kind of a live on social media, but also from different locations here as we're in the safer at home. And so just to get things started, actually, I thought I'd ask you both about that. I've had conversations with you as we've been doing remote work at LCHT, but we've been going through stay-at-home weeks, and now in Denver, in Colorado, what we're calling safer at home. But I thought I'd just open things up before we get into human trafficking stuff to ask you each what's been challenging during this time. And since hope is the theme, maybe one thing that's been hopeful for you. Brittany, you want to start us off?
Sure, thanks. I think the challenges are a little bit different every day or every week. So I thought I would just speak to sort of what's coming up for me the most today. And it's simply just missing being with people. I think as I sit here and have this conversation with the two of you, people that I count myself lucky to work alongside and whose company I enjoy so much, I'm just really feeling that longing to just physically be together to have this conversation in that way instead. As far as hopeful, there's just been a lot of hope tied up in this. Two things that I've been thinking about a lot are just, one, I'm really grateful that people continue to care about human trafficking and to turn towards this issue when we're all navigating a crisis that affects everyone in individual ways. We recently held a training to bring advocates onto our hotline, and we had to shift to hosting that virtually. So that's the first time we've done it in that way. And we had 31 people show up and commit to 2 full weekends of training and a year of service to our hotline, even while navigating this. So I was really inspired by that. And I've also just enjoyed noticing all of the entrepreneurship that's popping up during these times and seeing people sort of combat the hardship that's come up with new ideas for social impact.
Totally, and we're going to talk more about volunteer opportunities with anti-trafficking in the hotline in a bit, but definitely was inspired to see how many people showed up for a virtual training to be part of the movement in that way. How about you, Amanda? What's it been like for you in this time?
Well, I think there are sort of the day-to-day challenges over the past 2 months of navigating this idea of working from home, working on really heavy topics and seeing that news cycle daily. And then I've become a stand-in teacher for my 2 little ones, and who may or may not pop in during this live broadcast. Just that unpredictability and that space of navigating new home dynamics, just navigating new community dynamics, all of all of those, I think, personal challenges coupled with just that daily infusion of how things are shifting in our world and what we're learning. So for me, I think the hopeful piece is that in some ways the days feel longer. In some ways they feel like I'm able to really connect with my colleagues in different ways. Zooming with friends and colleagues that are in England and also just down the street feels normal. And that connectivity has really brought a different way in which I think about who my community is and how to remain connected with folks. So I think we're all trying to be really good listeners and trying to just hear all of the different challenges and ways in which we can just support each other in a new way. So I've enjoyed getting out of a routine in some ways and just challenging that.
Totally. Experiencing that here too with our 4 kids who are currently gone, but it's certainly been a time where we've all had to pay attention in a different way to the world around us and how we live in it as individuals, as families. But that doesn't mean, again, that these issues that we care about aren't still issues. And so I know a lot of you who follow our work and are partners with us have been asking what's going on with human trafficking right now. What's it look like during coronavirus? What's changed? And so we wanted to just take a minute to share some of those things. But I guess I would probably ask you first, Amanda, to comment on that. How has this pandemic affected the issue of human trafficking? Are there certain groups that are more at risk in these moments? What can you tell us?
Yeah, first, I think this is a great question. And I think this, like so much of our information, is changing daily. But I will refer to my colleague, Karen Napolitano, who posted a blog just a little bit ago on our website, where you can find a lot of different links to current resources and current reports, and really highlighting some of what's being published now. I do see a lot of our colleagues trying to produce content so that we can learn in real time what it is that we're seeing both around the US as well as globally. And so I think some of the challenges are the same that we struggled with prior to the pandemic. I think human trafficking has been made worse by the pandemic in a few key ways, however. So some of those vulnerabilities around people accessing basic needs, people being able to provide for their families, it's all been intensified during this time period. And so some of the new challenges are that the pandemic, of course, has created new challenges for people and new vulnerabilities for people that might have been in a more stable position, might not have been really focused on survival in the way that they are now. And so I think the third way that the pandemic has really impacted human trafficking is that a lot of those communities and the supports, those systems that were set up to prevent and protect and support individuals have totally shifted or have totally been rocked in ways that people cannot access those resources like they could more easily before the pandemic. So some specific examples, I think, are that people who already were in abusive situations, maybe living with their traffickers, for instance, have now been sheltering in place. They've been safer at home with the individuals that are exerting that power and control over them. We know from lots of different sources around the country that we've seen more of an uptick in reports of domestic violence or child abuse or more serious crimes that are occurring. And so really paying attention to what we are learning in our different communities and what that looks like in our state is something that's top of mind for us. We see people that are taking more risks to meet their basic needs for survival, to provide for their family. And so a lot of folks that are in low wage jobs, both in the formal or informal economy, may be at this greater risk because they're willing to compromise perhaps with not sharing abusive situations, with not reporting an employer because they need to earn some of that money to share with their families to survive. So maybe they're more willing to tolerate unsafe working conditions or to endure some of that exploitation or abuse that's occurring, because right now we're in such an unpredictable state of life. And so in this state and in many states, as we gear up for summer growing and harvesting seasons, we see migrant farm workers in particular who are not only at risk during normal times around ways in which ranchers, ways in which our agricultural industry has documented previous examples of human trafficking. Now we see that some of these same hosts are putting greater restrictions and limiting the movement of farm workers, and including being able to access some of our colleagues who are doing great advocacy work. So thinking about ways in which people are controlling movement, ways in which people are holding documents and passports, for instance, that has all continued, if not been exacerbated by this pandemic. And so I think as we're really considering root causes that lead to trafficking, I think that's the greater focus right now around people who are needing access to food, people who are struggling with poverty on that line of poverty, people who need shelter or a safe place to stay, and people who need income. Those are the things that we're paying attention to right now.
Definitely. Thanks for that, Amanda. And I know you mentioned Kara wrote a blog that got a little bit more into some of these groups, and you can check that out at combathumantrafficking.org/blog. And again, thanks for joining us. This is some of the laboratory to combat human trafficking together here in Denver, and from Littleton myself. And today we're doing Stay at Hope, a check-in on human trafficking during the time of COVID-19. And I'm here with my colleagues Amanda and Brittany. Brittany, I want to turn to you because obviously a big part of your work is managing and running the Colorado Human Trafficking Hotline. And in a time like this, I know the hotline is very important in terms of how people access resources. But I know you hear directly from survivors through the hotline. I'm wondering if you could comment on maybe what particular challenges are survivors experiencing during this time.
Sure. I'll start just by acknowledging that, what I'll share, it relates only to calls that we're receiving to Colorado's Human Trafficking Hotline, not the entirety of the survivor experience during this time. But what we've noticed is that for the most part, needs from survivors that they're coming to the hotline with remain the same. But as Amanda was sort of mentioning, their ability to access services has changed and shifted a little bit. And specifically as it relates to housing and shelter, which is the most common sort of need that comes through to the hotline, not just during this time, but prior. And, the economic impact of the pandemic, and as Amanda has increased demand on shelters. And as Amanda mentioned, this increase in the prevalence of, child abuse and domestic violence has also increased demand on safe houses. And so we are hearing from survivors who are having difficulty finding an open bed. And housing just remains difficult to access. And when we think about sort of the importance of basic needs being met at a very critical stage in a survivor's trajectory, it's a very real thing for us to hear from a survivor who says, I've left or I've escaped. I need a place to stay tonight that's safe, or else I will have to go back. And so people are making really difficult choices in those moments, and especially right now as there are just fewer beds available of, encountering danger on the street or returning to a place of semi-normalcy and safety, but a context within wherein exploitation is occurring, if you will. I think that the shelters and safe houses and the people who provide those services are doing their very best to adapt during this time. And I especially want to highlight some of the work that the Colorado Coalition for the Homeless has done to set up 2 auxiliary shelters in Denver, one for men and one for female identified individuals who are experiencing homelessness. They're in very large areas, one's in the Coliseum, where people can practice social distancing as best as possible within that context in order to increase the safety of people experiencing homelessness during this pandemic. The other thing I just want to note about the hotline is the biggest change we've seen during this time is that typically a third of our calls come in from community members who are reporting observations of human trafficking. And as everyone has moved towards sheltering in place and become more insular, everyone's shifting to very understandably needing to spend more time and attention adapting to this current time, taking care of themselves and their families. And then pragmatically, we are just out and about less, seeing one another less. And so that disconnection has caused a very sharp decrease in the number of calls we are receiving from community members. And so as we begin to sort of phase or reopen in phases, whatever that ends up looking like here in Colorado and elsewhere, I really just want to encourage bystanders to stay up and stay vigilant. Because we do know that exploitation is continuing to occur during this time, and because of all the impact, it will continue to occur and perhaps even increase beyond this time as we try to recover from all of this, economically, emotionally, socially, and so we need to rely on those people to be looking out and caring for one another.
Definitely. And Brittany, I know there's been an exciting development in the last month, really, in terms of how survivors can access resources. So even as we're navigating a pandemic and considering how do we connect people who might be exploited right now with the resources they need, there's been a development with the hotline itself that's pretty exciting. And I'd love for you to share kind of what that is and how people can get to it.
Yes, absolutely. So the hotline, what sits under our Colorado Human Trafficking Hotline is an online or resource directory, if you will, that includes over 300 organizations and individuals across the state of Colorado that have training in human trafficking and are prepared to offer a variety of services to survivors who are connected to them. And so this is what the advocates turn to when we receive calls from individuals in various parts of Colorado with various needs in order to offer them a resource that meets those needs. We really increased at LCHT and certainly within this program, really strive to increase access to resources and to break down barriers in that regard. And so we just recently launched the online version of our resource directory with a small number of those referral partners featured. And the goal there is simply to give people another means of access. So someone can call the hotline now to seek resources, someone can text us to seek resources, and now someone can go online and search for the resources that they need without having to interact with someone else if they don't want to, sort of at their stage of change. I also, when I think about the resource directory as it relates to sort of addressing human trafficking, I think about protection and partnership. And so sort of giving that information to survivors, to people that it belongs to, that's one piece of it. And then the other piece is partnership. And so a third of our calls that come into the hotline are from providers, so service providers, healthcare providers, other first responders who have encountered exploitation in their job, in the field, with someone that they're working closely with. And they often call to gain understanding of whether or not they're identifying the right thing, but also understand what to do next and what resources are available for that person. I think when we work in silos and we forget to pause and create partnerships and collaborate, we end up recreating the wheel and we put more work on ourselves. And so putting the resource directory online is also there to benefit service providers in their work, and for them to have an immediate access point if they're looking for something for someone that they're working on behalf of.
Definitely, and as you've been talking, there's a real easy way to get at our online resource directory. You can go to combathumantrafficking.org/hotline, and there you'll see you can call, you can click to call, you can text an advocate, and now you can search. So independently, folks can search the resource directory. We're beginning to add more of the entire statewide resource directory, but we're proud. It's a big development in terms of folks being able to get at the help they need, the referrals they need within anti-trafficking work. So well done there, and a pretty exciting development for sure. We're just going to spend a couple more minutes together. I'm going to turn back to you, Amanda. Thanks for joining us, everyone, for a few minutes as we talk about how we're staying at hope here at the Laboratory to Combat Human Trafficking. checking in on the issue of trafficking during COVID-19 and what we're doing about it at LCHT. So, Amanda, maybe just to turn back to you around the other aspects of our work. Brittany touched on Hotline and how we're connecting survivors to those resources. How else are we adjusting our efforts at LCHT, and what would you like to share?
Yeah, no, this is great. I think everyone is continuing to adapt both personally and collectively. And some of the efforts that we've made, for instance, around our research program is to write. So like a lot of other groups, producing content, sharing as much as we can, reflecting on what needs to be out there for all of us to learn from and build upon. We've been focusing a lot on writing for that program, as well as participating in the Governor's Colorado Human Trafficking Council research efforts, which are looking to incorporate greater survivor voice into our state's response. We've also begun delivering some virtual webinars and shifting to virtual platforms so that the coming few months we are able to support that continued learning. Meanwhile, shifting our in-person trainings to either the fall or next spring, including the organizing of an effort to bring together Colorado's anti-trafficking partnership leaders. So we've been actively planning that, likely for next year. We've also been establishing new partnerships, really working to stay in touch with our existing partners and then to build new ones, including in the hospitality industry, and understanding how the training that workers in the hospitality industry need, for instance, and how to deliver that content virtually. And then I think in a lot of our time has really been spent thinking about how we support future human rights leaders through our leadership development program. And so we had two fabulous interns this past spring that completed their internships with us over Zoom. And now we have shifted our 9-week program for the summer to be entirely remote, and we'll be supporting 8 folks from around the country and the UK to be able to participate in weekly sessions and continuing to get that education that's critical for them to be able to complete their academic requirements. So we're super excited about that, and really just thinking through how do we maintain team and how do we create that online learning and dialogue. So
definitely. So adapting as we all are, and like we've been saying in so many cases over the last month, the world stopped in so many ways, but human trafficking didn't. And so here at LCHT, we're figuring out what that means and how we can continue to deal with one of the most important human rights issues of our time. And you have the opportunity to do that with us. Many of you may have noticed that Stay at Hope has been our theme here for the last month or so, and we are inviting folks. As we say, we don't know what the future holds, but we know you can make a difference today. And we are fully aware in these moments of the challenges that so many of us are going through. Many are unable to give directly or donate right now, but if you can, anti-trafficking work needs your help. So I want to share 3 ways you can give. And as you see, you can visit combathumantrafficking.org/hope and figure out what we're doing and who all is joining us. But there are 3 things we're asking folks to consider: to make a one-time gift, to make a monthly pledge. As we know, some maybe would like to spread that kind of giving out for the causes they want to support. And then the 3rd way is to volunteer. As we said, many can't give right now, and Brittany mentioned earlier the hotline as we continue to serve the state and connect survivors to support and help. We need volunteer advocates. The next training is still a few months away, but you can make that commitment as well over at the Stay at Hope landing page, combathumantrafficking.org/hope. So it looks like we pulled this off, this remote multi-site live stream situation. We'll find out if the universe joined us in any way. But Brittany and Amanda, it's good. It's good always to see your faces, and thanks for being part of this morning.
Yeah, thank you.
Thank you.
All right, take care, everyone. combathumantrafficking.org/hope, and we hope to see you and take care of yourselves in this moment.
Thanks for listening.